Hi, this is Modern Dental Assisting Book, Chapter 5, continued. This is patient records and ownership of dental records and radiographs. So with patient records, again, it's very important that you know that they are legal documents and they have to be protected and handled with care. So when we make any kind of corrections to patient records, the only way that we can make a correction is with a singular line through the entry, if it is a paper document, with our initials and the date next to it. Then the correct entry underneath it. If it is a computerized EHR document, there will be a way to correct the entry in the computerized system and then put the correct entry in underneath it or next to it. We have to have the complete chart together. If it is a paper chart, all of the exam records, the diagnosis, the radiographs, consent forms, updated medical histories, copies of medical and lab prescriptions, and correspondence to or from or about the patient filed together in the patient record and all in one place on an EHR or electronic health record. So that is very important to have the chart organized and each chart in the same order. So when you go from office to office, the charts typically are in the same order. So administrative on the left side and clinical documentation on the right side. When we go to ownership of dental records and radiographs, it is the dentist. You need to know that the dentist technically owns all patient records and radiographs. So the patient records are acceptable in court. So the date and the details of service rendered for each patient should be clear. Nothing should be left to memory. You're not going to do all of your, see all of your patients every day and then go and write up or type up all of your charts later on. You're going to make your chart entries as you are seeing your patients so that you don't forget any details. You think that a detail is minor, nothing is minor. All of the details are major and everything is important. Nothing should be left to memory. So incomplete or unclear records are damaging evidence in a malpractice case. It could be the difference between the outcome of the case. So every entry in a chart should be made as if it's being seen in a court of law. Patients have the right to access. That means to review and to retrieve or remove their records and radiographs. But they do have to give notice, and the originals are always the property of the dentist. So the originals are not allowed to leave the practice without the dentist's permission. That means that, yes, the patient has the right to review their records and to remove their radiographs, but that means a copy of those records. The original records are the doctors, and they need to maintain those records because if they are ever called into court and they don't have those records, they could be in a lot of hot water. Also, they need them for forensics. A lot of times, dental records are referred to if there is a case of mass disaster or someone is lost or missing and they need to identify a person. They will refer to their dental records. If the dentist does not have those dental records, they cannot use them to identify that person or those people. So we need to maintain the integrity of those records for those reasons as well. That is all that we are going to be going over in Chapter 5 today. Have a great day.